Good evening. This is Dr. John Bennett, broadcasting from Miami. Tonight we have another in the series of Google Hangouts for Parkinsonism education. And we have with us tonight Dr. Abdul Rana, a neurologist from Toronto, a world-renowned Parkinsonism educator. And tonight, Dr. Rana will be talking about dizziness and Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett. How are you tonight?
Very good, very good. Is it snowing up there again in Canada?
No, no more snow.
Well, that's
a little bit chilly, but
I guess you had enough. Okay, I'll start right in with the questions about it, about dizziness and Parkinsonism. What is the cause of dizziness and Parkinsonism?
Most patients report dizziness, which is indeed lightheadedness. So the lightheadedness is due to a postural drop in blood pressure in these patients. They have a sense of fainting when they stand up from a sitting position or a lying down position. So when they stand up, their blood pressure drops. So because of this postural lightheadedness, they feel a postural dizziness. Usually a drop of systolic blood pressure up to 20 and a diastolic blood pressure up to 10 is considered a diagnostic of postural lightheadedness or orthostatic hypotension. But some patients may report symptoms of postural dizziness even when the blood pressure drop is less than this. And other patients may not have any symptoms even when the blood pressure drop is a bit more than this. Usually the dizziness, it does not start in the beginning of course of idiopathic Parkinson's disease. It usually comes on after maybe a couple of years once the diagnosis has been made. And as Parkinson's disease progresses, the dizziness or postural lightheadedness becomes more prominent. If this occurs in the beginning of course of disease, then the diagnosis may be some other conditions such as multiple system atrophy. Postural hypotension can lead to falls. Also dopaminergic medications which are used to treat Parkinson's disease and antipsychotics which may be used to treat psychosis in these patients, they may increase these symptoms. And some patients may have essential hypertension, and the treatment of essential hypertension might have started much before the diagnosis of Parkinson's disease. But once these patients are put on these anti-hypertensive medications, they are continued on these medications, and because of autonomic dysfunction, the blood pressure of these patients stop with time, but in spite of a drop in blood pressure with time, these blood pressure medications may not be reassessed or not lowered. So these medications may make their condition even worse.
Okay, what is the mechanism of the dizziness and Parkinsonism?
The likely mechanism of dizziness in these patients is autonomic dysfunction, which leads to postural hypotension. In these patients, what happens, they have the pathology of Parkinson's disease involving the peripheral sympathetic cardiovascular denervation. Those patients who have dementia, they have even partial hypotension more frequently. And partial hypotension may also be seen in patients with Lewy body disease. This does suggest that the Lewy body pathology is present in the peripheral autonomic nervous system. The autonomic nervous dysfunction not only causes postural dizziness, but it also causes other symptoms such as urinary bladder problems, constipation, sexual dysfunction, abnormal perspiration, cold sensitivity, skin problems. The autonomic nervous system in these patients is very vulnerable to alpha-synuclein pathology, which is a characteristic of Parkinson's disease. And cardiac sympathetic denervation and alpha-synuclein pathology in the pre-symptomatic phase of Parkinson's disease it could be mild and even may start much before the motor symptoms, but as the disease progresses, this slowly worsens, and maybe 1 to 2 years into disease, patients may start feeling these symptoms of dizziness. The cardiac sympathetic denervation, which we see in Parkinson's disease, is not just specific to Parkinson's disease, but it can also occur in other neurodegenerative disorders, such as multiple system atrophy. Barak proposed the pathological staging of the progression of Parkinson's disease, and he suggested that the earliest pathological changes in the central nervous system occur in the lower part of brainstem, with the absence of pathological changes in substantia nigra in the initial phase of Parkinson's disease. So the cardiac sympathetic denervation, which is responsible for the postural hypotension, it may start before the alpha-synuclein deposition occur in the at the other sites. And involvement, although the involvement of the peripheral autonomic nervous system was not considered by Brock's staging scheme, but the Lewy body pathology does involve the central autonomic nuclei in the caudal brainstem in the early stages. It is becoming increasingly clear that the peripheral nervous system is affected early in the course of Parkinson's disease, even before the motor symptoms start becoming prominent. Patients with orthostatic hypotension may have more cardiac sympathetic denervation as compared to those who don't have orthostatic hypotension.
How is dizziness managed in Parkinsonism?
The management of postural dizziness in these patients could be a challenge. Sometimes it may require many different strategies which can maybe improve this problem partially, although sometimes they may not relieve the problem completely. First of all, the patients should be educated so that when they start feeling this type of problem, they can talk to their physicians. And physician can rule out other contributory causes, such as some patients could be on diuretics, which may cause this problem. They could be on beta blocker for something else, such as high blood pressure, or they could be on other antihypertensive medication or antipsychotics, which can make this problem worse. Patients should try to increase their fluid intake, and they should avoid standing at one place for a prolonged time. Also, at night time, they should try to elevate the head of the bed. They can either use a higher pillow, or they can put some blocks under the both legs of the bed on the head side, and this does increase the blood vessel tone. Also, slow rising from a supine position or from a sitting position, especially from a bed or chair. If they have been asleep all night and when they rise in the morning, they should try to rise slowly and sit down on the edge of the bed first before getting out of the bed. And once they stand up, they should stand up slowly, and they should wait before they start walking. Also, if they start feeling any lightheadedness, they should try to sit down immediately or maybe lie down. Sometimes drinking caffeine may help. Also, they should take special precautions after heavy meals or hot showers. It occurs in many patients that they go for a dinner with the family or maybe eating out, and that it turns out to be a big meal, and sometimes they may consume alcohol with it. So that increases their risk of postural hypotension, because in such cases the blood pressure also drops. Also, when they arise in the morning, they should try to drink a glass of ice cold water, which helps to maintain the blood pressure. If they have a risk of high blood pressure, then at night time when they go to bed, they could drink a glass of warm water so that their blood pressure at nighttime would stay low. Also, when they are doing exercise, they should avoid excessive exercise. Also, they should not drink alcohol. That makes things worse. There are high elastic compression stockings which they can wear in the day, but they should be really high up to thighs. Those below knee stockings may not be helpful. Also, if they don't have any history of CHF or high blood pressure or diabetes or stroke, heart disease, high cholesterol or other vascular risk factors, a free salt intake may help these patients. If these strategies don't help, and then of course the physicians have to use medications such as fludrocortisone and midodrine, although some of these medications may have risk of fluid retention or postural or nocturnal hypertension. When they go to bed at nighttime, their blood pressure may be raised. So the physician has to monitor their blood pressure. Patient also can monitor their blood pressure at home, so that they don't develop high blood pressure, which is a risk for a stroke as well as heart attacks. There is a newer medication, droxidopa, which was just approved in U.S. by FDA for treatment of partial hypotension. Although this drug has been available in Japan since 1989.
Okay, is there a high percentage of Parkinsonism patients that are affected by dizziness?
Excuse me, I didn't understand.
Is it a high percentage of patients, Parkinsonism patients, that are affected by dizziness? Would you say?
In the beginning of course of disease, not many patients would complain. Okay. But once you start them on medication and increase the dose, then they may start noticing this, and maybe within first 2 to 3 years, they might start feeling. So about, I would say, 1/4 to 1/3 of patients may complain of dizziness, especially okay, when they are on a relatively higher dose of dopaminergic medications.
Okay. Is there anything else to add before we close on this topic?
Some patients may be quite incapacitated from dizziness. They may have to limit their walking, limit their going out, and they could be quite disabled, especially they may pass out. I had a patient who passed out in my office. She was a Parkinson's disease patient, so she was sitting in the waiting room, and I was late that day. I was running behind, so she was in the chair for quite some time. And when her turn came, and my staff wanted to call her in, so she stood up and she just passed out because her blood pressure was quite low. So one of the important points in these patients is that their blood pressure should be monitored closely. What happens in most of the elderly population, because majority of these patients they are on antihypertensives because they have essential hypertension, and so first they are on one medication. Sometimes they could be added another medication. At times they could be on 2, 3 different antihypertensive medications. So once these medications are started, sometimes the reassessment is not done at optimal times. Their blood pressure is not closely monitored, or when they come to clinic, maybe once every few months, their blood pressure is normal. So they end up going on these medications indefinitely. So because with autonomic dysfunction, their blood pressure drops with Parkinson's disease, so these medications become a bit too much for these patients. So that type of aggressive treatment of high blood pressure in this population is a quite important factor leading to this problem. So I would suggest if a patient has essential hypertension and they are on antihypertensive medications, I think they should be screened every few months, and their blood pressure should be monitored closely. And sometimes we have to suggest to their family physicians to lower their high blood pressure medications, because their blood pressure becomes too low, and they can't walk, or they can maintain their posture because of that. Also, the postural hypertension can cause in patients fatigue. Some of the patients may feel very tired. Once their blood pressure is low, they don't have enough energy, and they report to us that they feel tired and they feel fatigued. And because fatigue is an important non-motor symptom of Parkinson's, and it could be a manifestation of bradykinesia. So if the neurologist is not careful and does not monitor the blood pressure, and he takes the fatigue as a manifestation of bradykinesia rather than low blood pressure, and increases the dopaminergic medication, that would further lower the blood pressure, and that could complicate the patient's problem even further. So this is a very challenging situation, and you have to be quite careful to assess their fatigue or their tiredness, whether it is due to bradykinesia or is it due to low blood pressure, because the treatment of bradykinesia, which is increasing the dopaminergic medication, may make their postural hypotension even worse, and instead of helping them, you could cause them more of a problem.
Very good, very good. Okay, doctor, thank you for giving us an excellent summary of dizziness and Parkinsonism. All these videos can be seen on Parkinsonism TV. All of Dr. Rana's videos can be seen on Parkinsonism TV. And join us tomorrow night at 9:30, where we have another presentation from Dr. Rana on various aspects of Parkinsonism. Good evening, Dr. Rana.
Thank you, Dr. Bennett. Good evening.
Thank you.